Welcome to this month's newsletter. First, it's May, so I want to talk about melanoma awareness because this is Melanoma Awareness Month. Melanoma is the deadliest form of skin cancer, and it does affect over 100,000 Americans every year. And the great news about melanoma is that you can detect it early, and when it's detected early, it's super treatable. So this is a good time to check your skin at home every month. If you see any moles that are changing in size, shape, or color, or any new moles that don't look like the others, you should have them checked. Make sure to wear your SPF every single day. And the point of melanoma awareness is early detection. So if you haven't had your skin checked this year, May is a great month to do it. Next, I want to talk about the tear trough area or the under eyes. I get a lot of cosmetic concerns from people where their tear troughs look hollow or they have dark circles that really bother them. And there's a lot of different procedures that you can do, filler being one of them. A lot of people don't want to do filler because sometimes it can give you an unnatural appearance. And there are some alternatives now. We now offer something called PRFM gel filler. And this is where we draw your blood, we spin it down and take the growth factors from it. We can then heat those up and turn them into a gel, and we can inject them into the under eye area. This creates immediate results where you get almost a filler-like effect, but then you also continue to build collagen and elastin over time by the release of those growth factors. So you continue to see improvement in skin texture, quality, and overall appearance. So if your tear troughs bother you, it may be worth just scheduling a consultation with Bailey or I, and we can walk you through how this procedure works. This month, we have another patient case study.
Hi, Dr. Salyards. I have been noticing some discoloration, some dark patches on my skin. I also noticed that in the summer or when I'm in the sun more, they tend to be darker.
So this patient is dealing with something called melasma, and it's where you can get a pigmentation along the forehead, cheeks, sometimes the upper lip. And melasma is treatable, but it is chronic and it's tough to treat. So it's usually multifactorial how I do this. So the number one thing is a tinted mineral sunscreen. You do need the tint because that helps block visible light, which also affects melasma. Next, I usually will use a compounded prescription cream, and it blends a few different ingredients that will lighten the skin over a period of 3 months. After that 3-month period, I will then add a maintenance plan, and the maintenance plan is going to usually involve things like vitamin C, retinol creams, and then I actually really like Skin Better's Even Tone Intensive for this. It's a hydroquinone-free lightener that continues to improve results and keep the ones that you have. There are some procedures that you can do. So a light series of chemical peels is also really helpful for melasma and improving results. And then finally, what I tell people is maintenance is key. This is a chronic condition. You will never not have to treat this, but as long as you stay on top of it, you can keep your skin looking very, very good. So if you struggle with pigmentation, we could do a consultation or we can get you in for a medical visit and we can improve it.